Infectious disease specialty is much broader than most people think. It doesn't just include your everyday illness like a sore throat or something like that. It involves complex medications, antibiotics, antivirals, dealing with complex conditions such as hepatitis C, HIV, which really require a deeper understanding. I am one of the only practitioners here in Middletown, which makes me very unique because I am centered between Dayton and Cincinnati, which helps patients who really have that need. They have somewhere they can go. It kind of goes back to why I went into medicine. Many years ago, my mother, when we were young and struggling, she went back to nursing school, got her LPN. That was inspiring to me. And so I take those days that we struggled to really, think about how my patients also struggle. And they need somebody who's strong, who can be there for them. There are many patients who see me who have chronic diseases such as hepatitis C, hepatitis B, and HIV, and they want to follow with somebody who understands those medications and follow them long term. So one of the influential things in my life was I took a summer and traveled to Kenya where I saw HIV patients, and this was before I even wanted to be a doctor, and it actually kind of inspired me to go to med school, and ultimately I ended up being an infectious disease specialist. Seeing patients with HIV in Kenya gave me a better understanding of what they needed, the lack of resources. Being here in Middletown, I feel like I can provide those resources for patients. I see patients every day who have HIV, and I understand the stigma of that, but I am able to provide a resource for them and treatment for them so they can live a normal life. I think when people walk through the door, they're going to be very welcomed by the medical staff, and I hope that they have a great experience with me, because that's why they're here. They're here to see me, and so I can treat them and make them feel better. I think people will see a very open-minded person when they come to see me, and that they can feel free to open up and let me take care of them, and more importantly, just be there for them, sometimes emotionally.